Hi, this is Dr. Kreshe. Welcome to Ethical Considerations in Trauma and Dependence. We'll spend a lot of time talking about trauma in ADS 125 and in your other courses. In looking at trauma as it relates to ethics, we wanted to look at the following topics. What is trauma? What is the relationship between trauma and addictions and the ethical issues that come up in treating somebody with trauma? The definition of trauma you can read here. What's most important is that you experienced the event, or you witnessed an event that occurred to something else, or you heard about a really frightening or terrifying event that occurred to someone else, or you have repeated exposure to distressing details or events like sexual abuse or physical violence. Often police officers end up listening or looking at this several times. So SAMHSA tells us that individual trauma results from a variety of things, and it causes long-lasting effects on the individual. If you're wondering to what extent trauma affects individuals, here, if you can see in this infographic, trauma is the #1 leading cause of death for those ages 1 through 46, and about 2 out of 3 individuals who suffer from addiction have a history of trauma. So from an ethical perspective, it is important for us as practitioners to become competent in understanding trauma and its effects and how this will in turn affect the way we work with people. There are different types of trauma, and you can see the list here. A lot of the trauma that we will be dealing with is complex and chronic and developmental. Developmental trauma, people experience a traumatic event and they kind of get stuck at that age where the trauma occurred. Post-traumatic stress is actually the diagnosis that is often given to individuals who suffer trauma and whose functioning is impaired in either socially, job, or otherwise, so that they cannot function in society because of the acuity or how difficult their symptoms are. As far as the connection between trauma and substance abuse, we see a lot of comorbidity. So people who have both trauma and substance use, often drugs are used to self-medicate because of the pain caused by the trauma. We see people that become more vulnerable to stress. The trauma has put them in a state of hyper alert or hyper arousal so that their bodies are dysregulated and the stress response is heightened. We know that gender plays a huge factor, as the number of victims who suffer from trauma, females have a higher incidence than males. Finally, avoidance of trauma reminders is a really important thing to be mindful of, and many times self-medication is an effort to avoid the trauma reminders. By the way, a lot of this is subconscious, and the individual isn't acting in any way or particular way on purpose. So in looking at trauma, what we want to think about in terms of ethics is who are the patients and how can we keep them safe, or how can we treat them safely? So this involves the ethical principles of benefits and autonomy, and fidelity. Often we see the highest risk patients involve those with personality disorders, suicidality, uh, involvement in legal disputes, and litigious patients. So these are patients that have multiple lawsuits or will sue for anything else that's going on, as well as history of adverse childhood events. Remember, at the very minimum, the ethical principles that we're talking about in this class include autonomy, non-maleficence, beneficence, justice, and fidelity. Often when dealing with these individuals with high-risk behaviors, it becomes really difficult to be just and to be faithful because these individuals have such a high degree of problem that counselors often can't meet them, or it's too much, and then we can't serve them. So in a situation like that, the best thing we can do, the most beneficent, may be to refer them out, or to get supervision, or to get additional colleagues to assist us. Other ethical challenges associated with treating those who suffer from trauma include re-traumatizing the client. You don't ever want to get the client to tell you their story if you think it's going to make it worse for them. Eventually, you'll figure out a way to create a more supportive environment, but when you have a client tell the story, it's like you're opening up a wound, and then unless you're willing to take care of that wound, suture it up so it won't bleed anymore, you really can't open it up. Okay. Another huge problem that we have when treating those that are so vulnerable is creating a sense of dependence, so that the client becomes dependent on you for a variety of things because they've formed this connection and because they've been traumatized, and so you want to take care of them. So you want to try to avoid that. That's one of the pitfalls. How do you foster independence, autonomy for someone with this background? It's always important to keep in mind informed consent, mandated reporting if it involves child abuse or adult abuse, and then reassuring the individual about confidentiality, access to records, and about the parameters, if at all, of sharing information with relatives. To look closely at the cycle of addiction and trauma, we see that it's a vicious cycle, and many of you already know this, but we have emotional pain, shame that's related to the situation or the environment, and so that's here, right? And then we have self-medication with drugs and alcohol, and that's, how we start the substance or the addiction problem, which then leads to complications at work and relationships, which only intensifies the emotional pain and suffering and the capacity for cope, which then leads to more drugs and alcohol to be able to manage the situation, and then things just get harder and harder and harder. So part of what we need to do as counselors is break this cycle. SAMHSA has trauma-informed care protocols, and the protocols inform the realization, and we'll talk about this more with detail in another class, to understand the prevalence of trauma is the beginning of the work that we need to do, recognizing signs and symptoms, responding appropriately, and resisting the re-traumatization of others. This also includes ourselves. So this concludes our brief introduction to trauma and substance use disorder. I did put a couple of readings in this week for you to review, which I think will be very helpful. and I will see everyone in class.